and I'm a neurosurgery resident and scientist. I'm grateful to the NREF for their support to complete a postdoctoral fellowship at the University of Cape Town Neuroscience Institute with key collaborators at Harvard. I have a particular interest in pediatric neurosurgery, where genetic and molecular information are increasingly being used to understand disease risk and stratify patient treatments and outcomes. My ultimate goal is to deliver safe, compassionate, and effective neurosurgical care, combining technical operative skills and unique clinical insights with basic scientific discovery to improve care for neurosurgical patients and their families. I'm using induced pluripotent stem cells, or iPSCs, to make brain organoids, or 3D tissues resembling the architecture and molecular landscape of the developing human brain. I'm using these organoids to understand the molecular hallmarks of hydrocephalus, one of the most common yet challenging diseases in pediatric neurosurgery. Specifically, this NREF fellowship has directly enabled creation of the first brain organoids for any purpose on the African continent. South Africa, and sub-Saharan Africa more broadly, is disproportionately impacted by hydrocephalus, accounting for approximately 50% of the cases globally. And this is largely due to neonatal and early childhood infection. In addition, because Africa has over 2,200 unique genetic diaspora, understanding hydrocephalus in the African context is absolutely essential. First, to understand a genetic cause of hydrocephalus, I'm using brain organoids which harbor a patient-specific mutation to understand disease mechanisms, with the goal of identifying pathways that we may be able to target with drug therapy. Acquired hydrocephalus, however, is not caused by genetic mutations, but rather through downstream perturbation of signaling cascades triggered by exposure to pathogens or blood. Through detailed in vitro analysis, I will elucidate mechanisms underlying brain injuries which precede hydrocephalus in organoids that are representative of African populations where hydrocephalus disease burden is among the highest in the world. Using bespoke differentiation protocols, I am modeling the impact of patient-specific genetic mutations or neurologic injuries that precede hydrocephalus in organoids which recapitulate the developing brain cortex or choroid plexus. Finally, to connect patients, organoids, and mechanisms, we are performing single-cell and genome sequencing of human hydrocephalic cortical brain tissue that is normally discarded during surgery using a method that we've developed through recent NIH-funded work. I'm extremely grateful to the NREF, the Academy, and my mentors at the University of Cape Town, Harvard, and UAB for their support of this project. I hope this work is a stepping stone towards a Van Wagenen Fellowship, where I would be the first fellow to complete the fellowship on the African continent. And the impact of the collaborations and preliminary data obtained this year can be further leveraged to catalyze my career as a neurosurgeon scientist.